This VAWatchdog.org news video is brought to you by Bergman & Moore, LLC. Former VA attorneys now fighting VA for you. Call Bergman & Moore at 877-838-2889 or on the web at vetlawyers.com.
Now, new efforts to provide mental health care for returning troops. Betty Ann Bowser of our health unit begins with some background on today's developments. The unit is a partnership with the Robert Wood Johnson Foundation.
Point out to us who the insurgency are.
About 1.5 million American men and women have served in Afghanistan and Iraq. And the Pentagon says an estimated 20% of them are suffering from mental health problems. Other estimates are even higher. 2 recent reports have found that military personnel are not seeking help when they need it. The American Psychiatric Association said yesterday that it found 3 in 5 members of the military think that seeking treatment for mental health concerns would have some negative impact on their career. A larger study by the Rand Corporation last month found nearly 1 out of 3 service members reported a mental health problem or symptoms of traumatic brain injury, and only half of them sought help. That study also found that many of the returning troops thought seeking treatment would have a negative impact on their security clearance and their careers. During a visit today to a Fort Bliss, Texas treatment center designed to help troops with post-traumatic stress disorder, Secretary of Defense Robert Gates announced a policy change aimed at fixing that.
The most important thing for us now is to get the word out as far as we can to every man and woman in uniform, to let them know about this change, to let them know the efforts that are underway to remove the stigma and to encourage them to seek help when they are in the theater or when they return from the theater.
And I'm glad that you actually were able to verbalize, you know what?
Gates said under the new policy, troops and civilian employees applying for a security clearance will no longer have to admit they've had mental health treatment unless it was court-ordered or violence-related. He referred to the infamous question 21 on the form, which asks applicants whether they have consulted a mental health professional in the past 7 years.
It now is clear to people who answer that question that they can answer no if they have sought help to deal with their combat stress.
Later at the Pentagon, the chairman of the Joint Chiefs of Staff, Navy Admiral Michael Mullen, said he wants to send a message to everyone in the military.
Psychological health and fitness is no different than physical health and fitness. Both are readiness issues. Both are leadership issues. Getting this question changed is a terrific step to achieving better readiness for the individual and for the service. I hope it's also a great first step in changing our culture.
The new policy is effective immediately.
Jeffrey Brown has more on the story.
To what extent is stigma a barrier to treatment, and are service members getting the mental health care they need? We explore those questions with Colonel Lori Sutton, the director of the Department of Defense's Center of Excellence for Psychological Health and Traumatic Brain Injury, Terry Tanelian, a researcher at the RAND Center, who co-directed the recent study on mental health care needs for veterans, and Jason Forrester, director of policy for the advocacy group Veterans for America. Colonel Sutton, starting with you, define the stigma problem that you're trying to address today.
Well, let me start out by saying that today is such an important day. It's such a historic day for our troops, whether they be soldiers, sailors, airmen, Marines, coasties, whether they be in the Guard, the Reserve, whether they be veterans and their family members, because this marks a huge milestone in our journey to really eliminate stigma, that barrier that keeps troops and their family members from getting the help that they need. And so as Secretary Gates said earlier, we are so excited to be able to put the word out and get the word out at all levels so that we can move forward together and make sure that our troops, their family members, get the help they need.
But how ingrained, how big a problem is this stigma?
You know, I've been a psychiatrist in the Army for over 20 years now, and I will tell you, this is an issue for our troops, for our families, for our communities. It's an issue across America. We've made tremendous progress, but we've still got a ways to go, and today's milestone is another step in that journey.
Terry Janelian, what does your work show about the gap between those who need care but are unwilling to come because of stigma?
Sure. Based on our research, we were able to identify that among the top 5 barriers to getting care, when we asked folks what gets in your way of getting the help you need, 3 of those top 5 were about concerns for their career, that it could harm their career, that they could be denied a security clearance, or that their coworkers and fellow unit members may have less confidence in them doing their job.
So, and those are directly tied to the sense that there's a stigma because they've come forward.
They're really institutional or cultural kind of barriers to getting help. There's a concern and a perception among service members and veterans that by getting help, that it could be somehow used against them in their career.
Mr. Forrester, do you think that these steps today go far enough? Are they helpful? What?
They're helpful, but they're late. To Secretary Gates' credit, on June 21st of last year, he announced that he had hoped to remove question 21 from the security clearance forms. I'm glad that it's being removed now. I feel for those soldiers and Marines and others who've had to live with the hope of seeing the question removed for the past at least around a year and before that. Veterans for America's Wounded Warrior Outreach Program works across the country with service members who are coming back from multiple tours, often with inadequate time at home. And yes, they find considerable stigma when they return to their bases. The stigma is growing a little bit smaller, but unfortunately they still find considerable stigma, and they often find very long wait times to be able to see a mental health care professional on base. For instance, Fort Drum, New York, home of the 10th Mountain Division. The 2nd Brigade Combat Team, 3,500 soldiers, recently completed its 4th deployment since 9/11. When those soldiers came home, it was taking some of them up to 2 months to get a meeting with an appointment with a mental health care professional. This is late. It's laudable what's being done, but unfortunately, we're just realizing the magnitude and the great variety of steps that need to be taken to rectify
Colonel
the
Sutton, how do you answer that? An accessibility question is, even if soldiers come forward, is there a place to treat them? Is there adequate care available?
VAWatchdog.org, the nation's #1 independent veterans website, on the web at VAWatchdog.org.